Hi, everyone, and welcome to today's Company Spotlight, a platform where companies can articulate their core mission to decision makers in the HTM community. I'm Danielle McGeary, AAMI's Vice President of Healthcare Technology Management. And today, I'm here with Phil Settimi, the CEO of PartsSource. Welcome, Phil.
Hi, Danielle. Great to be with you and the AAMI community.
Well, let's get right to it. Can you talk a little bit about PartSource's core mission and how the company has evolved over time to get there?
Happy to. Our core mission is ensuring healthcare is always on. What that means practically is that we're improving the clinical availability of mission critical assets around US healthcare every day. The company started as an e-commerce and distribution platform for parts when folks were just beginning to do more of their own in-house HTM work north of 20 years ago. And that business and that mission has stayed true to its goal, but has evolved over the years from when we got started in the early 2000s to when I joined in 2014. And at that point, I had come in from a prior life as being a physician, having done my master's in biomedical engineering, really fascinated with hospital operations and efficiency and throughput. And as we began to engage with customers around what they were facing each day to deliver high uptime and availability of mission critical assets, they were plagued with process issues, technology issues, people and training questions, and ultimately we're spending a lot more time, effort, and money than we thought was necessary to accomplish their mission. And so we set out in this goal of building a technology-based business that helped health systems achieve this goal of better cost, better quality, better productivity, and ultimately high clinical availability of assets. And that's taken us down a really fascinating road in the 12 plus years that I've been at the company, in the over 20 years that the company's been in existence, now serving over 5,000 hospitals that interacted with our technology this past year, with over 1,500 of those hospitals who are now part of PartsSource Pro, which means that they've adopted our technology across their enterprise. Folks like Kaiser Permanente, Providence Health, HCA, Intermountain, Mayo Clinic, and many others. So we're really excited to serve this community, to drive mission critical uptime, to drive cost, quality, productivity. And that's really the mission we set out to achieve each day.
All right, so let's talk about AAMI Exchange. Is PartSource highlighting any new innovations to support HTM teams at AAMI?
We're really excited to be at AAMI this year in New Orleans, and we're excited to show off some really cutting edge technology. We focus a lot on where folks spend their time and their money. Over the last few years at AAMI, we've introduced great new solutions around parts management, around service management, and those were all based on a lot of empirical studies and work that we did here to help uncover challenges and ultimately introduce great, novel, evidence-based, data-enabled, tech-enabled solutions at AAMI. And this year we'll be back highlighting a continued focus on the transformation in services. Today, Danielle, an average hospital is managing 150 service contracts. 75% of those are relatively low dollar and long tail. They're all offline and analog management of those vendors. They're tracking down field service reports themselves. They don't have performance metrics on those vendors. And so we launched over the last year or two an amazing solution that's got tremendous demand and traction right now, with folks looking to, one, remove cost, remove complexity, and really digitally transform their organization. And that'll be in our booth this year. And then we've been developing a really emerging and cutting edge technology called Asset Uptime. This allows health systems to, in a single command center, evaluate and understand the status of all of their mission critical assets in real time, on a multi-vendor, multi-modality, and on a multi-site basis. So imagine a hospital being able to observe every morning that they're clinical and operationally ready to perform care by seeing all of their mission critical CT, PET, mammo, ultrasound, and other critical devices in a single screen, live and ready to deliver care. And today, that process is complicated by 10 plus internal software systems, 30 plus external software systems, over 300 different vendors performing service in any kind of a hospital environment each month. So this technology has been co-developed by some of the leading health systems in the country with PartSource. We'll have that in our booth throughout the weekend, and we'll actually be presenting as a company with the Mayo Clinic and with WakeMed on Monday morning about asset uptime and the evidence behind the approach to why we want to drive multi-vendor, multi-modality, and multi-site equipment visibility, and the impact it can have for health systems around the country.
And I love that because when you take away that granular work and put all of the data at the HTM professional's fingertips, that's more time they can spend working on equipment, which ultimately leads to better patient care and better equipment uptime. So, with that, I know we focused a bit on the how this affects HTM professionals, but can you talk and elaborate a little bit more about how this affects healthcare in general and how it helps the health systems?
Look, we've been committed to healthcare for almost 25 years here, and healthcare is in a bit of a predicament right now. It in a good day runs a 2% operating margin, and you've got a huge amount of pressure coming its way. There's talks about Medicaid cuts. There's talks about cuts to a 340B program for pharmacy. There's tariff impacts, and a lot of the products that are brought into health systems today, which represent 20% of their total costs, come from often overseas environments, and having a 20 or 30% tariff on that would basically eviscerate whatever operating margins hospitals have today. So we really focus in on how do we drive better patient throughput, better productivity, better efficiency. If we can do more with the resources in the building, we can produce better revenue, better contribution margins for hospitals, and ultimately better sustainability and survivability. But we believe that HTM has a key role in that mission, not just at the table, but leading the way to demonstrate that if we actually monitor the availability and capacity of our production lines, these are our CT scanners, our MRs, our mammography clinics, et cetera, that we can actually put visibility into the monitoring and management of these devices, into the efficiency at which we both diagnose their ills and get them back up into the clinical sphere. And that puts clinical capacity back into the network for health systems. And that gives them the clinical production lines to produce more units of healthcare for the same kind of resources that they're consuming today. That's how we think that HTM plays a role in, and ultimately PartsSource plays a role in not just the survivability, but the thriving of healthcare in the long run. We do all of this through technology, services, and data that we provide our health system clients. And all of this is built on a single enterprise platform that allows them to work as a common unit, even though many of our clients are scattered across multiple states or even regions of the country. But a single technology platform that uses a decision support engine for vendor selection based on over 3 billion data points that we've collected over the last 2 decades of history to make the best evidence-based decisions. We enable folks to drive continuous improvement with tools like formulary management so that they can select and express vendor preferences across their entire supply chain. Every transaction is tracked from a performance perspective so that they have visibility into how their vendors are performing, and they can benchmark their results across a nationwide set of results of their peers. And ultimately, we consolidate the buying power in the data from thousands of hospitals across the country that allow us to deliver this community benefit to everyone who joins PartsSource Pro. So they're able to save costs, they're able to drive labor productivity, they're able to improve the quality and sustainability of their supply chains, and they do it all in one system and one platform. That's our contribution to an HTM community that we believe is preordained here to play a huge role in improving the clinical capacity of and throughput of health systems by improving the clinical availability of devices. And our tooling and our company are built to do that every day, and ultimately in support of HTM teams around the country. So we're really proud of that mission. We're really privileged in the role that we play, and we love partnering with AAMI to help reach so many of those technicians and leaders, both in forums like this and, of course, at the upcoming AAMI show.
It's so true. And your solutions are so innovative and just really get to the core of what needs to be done, especially in a fiscally challenging environment for healthcare. And, we really appreciate yours and PartSource's support of Amy. And it's always such a pleasure talking to you and the team. So, everyone, please make sure you stop by booth 2837 and talk to the PartsSource team. And we're looking forward to seeing you all in New Orleans. Thank you.